Did you see that post?
People are talking.
Here's what's trending on the Rickey Smiley Morning Show.
Everybody know that the COVID-19 pandemic doesn't seem to be going anywhere soon, and parents are as concerned. Schools are reopening. Parents are really concerned in some counties, despite health concerns from parents and teachers. Now, on the line to help answer some of the top questions asked by parents is one of the best pediatric doctors in Atlanta, Dr. Tiffani Billingsly. Welcome to the show.
Good morning.
Good morning. We are so happy to have you. A lot of stuff going on now. COVID-19 infection rates are going down, but the death rate is still breaking numbers across the country. And with some schools going back to in-person learning, is it safe for their children in the classroom? That's what a lot of parents want to know.
Yes, so this is obviously one of the biggest questions I'm getting in the office. For kids who are returning to school, there are some safety precautions that I am stressing with my families. First, of course, making sure that your kids are wearing masks is really, really important. For all children 2 and up, this is really going to be crucial in us minimizing the spread of COVID-19. And also let me add that wearing it properly, so them putting it over their nose and their mouth, is something that we really need to make sure we're working on with our kids. And then, of course, good hand washing, practicing social distancing as much as possible. And if your child is not feeling well, please keep them home from school. I do suggest going to the CDC website because they have recommendations around what you can look for to ensure your school is as safe as possible. I will say my experience in my office, a lot of schools have been doing a good job in ensuring that, you know, if there is a case, making sure that parents are having to keep kids out, and many schools are ensuring kids are needing to be tested if they are returning to school. So again, I would look at those guidelines on the CDC website because those are going to help ensure that your child is following those guidelines that are going to keep the schools as safe as possible.
Dr. Tiffani, are there any reports out there that showing any new vaccine variants having any kind of effect on children any differently than adults?
So currently there are no reports that actually indicate that any of the new and the variants of COVID-19, the different strands now that we're seeing, there are no reports that are actually indicating that they're having a different effect on children than that of adults as of right now.
So should parents give toddlers and babies vitamins or supplements? Like, what can we do to help boost their immune system?
So, great question. You know, first, let me just say, when it comes to the immune system, vaccines. This is going to be one of the best ways towards building their immune systems during this time. And it does help to prevent a lot of severe illnesses. Obviously not COVID-19, but it does help minimize them getting some other illnesses that could otherwise be detrimental. It is still the season for getting the flu shot, so I do highly recommend that. But other things that you can do to help boost your kids' immune systems, multivitamins are good, especially those that have vitamin C in them, because that's going to help boost the immune system. But I do always recommend talking to your doctor first, because they're going to help you figure out what's going to be the best vitamin for your child. And then making sure they're eating balanced meals with fruits and vegetables, drinking lots of water, and getting in exercise as well is going to be really key.
Oh, now spring is right around the corner, and it's already registration time for sports. Are outside sports safe for children? You know, soccer, Little League football.
Yeah, great question. Now, of course, you know, doing things outside is going to always be better than being inside. So if parents are choosing to go ahead and register their children for outdoor sporting activities, again, the CDC has guidelines around the things that can be done to ensure safety. But a few things that I would stress is thinking about social distancing. So when that is possible, trying to enforce that as much as possible. Also, if your child is coming in contact with someone else, wearing a mask is going to be highly recommended. And then if that mask gets wet as a result of sweating and those kinds of things, changing it, because that's going to be, if their mask is wet, that's not going to allow it to be as protective as it should be as it relates to spreading the virus. And then disinfecting equipment, not sharing water bottles, all of those things are going to be really important to help keep kids as safe as possible with sports.
Right. Are you seeing the numbers go down, being the fact that they're getting up to 1.3 million shots a day? Are you seeing trends with the numbers going down, or less patients, less people? Less people being sick. What are you seeing in your offices from? And do you feel like this whole pandemic is going in a direction where it's starting to taper off a little bit?
So, of course, for my patients, the vaccine is not yet approved for my patients. And so to that end, I can't say that I'm seeing so much of a change in my kids who have been ill from COVID-19. Now, I will say, though, for many of them, they've either been asymptomatic or they haven't really had, they may have mild cold symptoms. So it's like fever, cough, runny nose. But their family members are the ones that, may still be dealing with a lot of the more severe complications of the illness. Having said that, children do still get, very ill. They can end up in the hospital. But generally speaking, I do think that we're headed in the right direction with us having the vaccine, because the more people who are getting vaccinated, then it will help minimize severe illness and then even those getting the illness altogether. And that will have then a trickle-down effect to their children as well.
Hey, another question I want to ask. Mm-hmm. All of the people, everybody that's listening with kids, and even for themselves, I know you you specialize, in kids care. How can people figure out and find out, how they can get vaccinated?
Great question. So, of course, right now it is still recommended mainly for first responders, healthcare workers, those who are over 65, or those who are caregivers for those that are over 65. So that's where the focus is right now. And to that end, if you're looking to get vaccinated, going to the Georgia Public Health website, because a lot of the different locations that are in Atlanta, or should I say throughout the state, are going to be listed there. And then also there are several different pharmacies now that are actually starting to post dates for vaccination. So I would definitely look at those options, and then contacting your doctor, because they can absolutely give you information on where to look, because frequently these dates for vaccinations are going to fill up quickly.
Yeah, and the same thing if you're in Texas, or if you're in Florida, if you're in Michigan, if you're in Virginia, South Carolina, Tennessee, all over the country. Y'all make sure y'all just apply that same information to your state, and and make sure you get on the list and get vaccinated. A lot of people have already been vaccinated, so you'd be surprised the avails, people getting vaccinated. Special care, the only somebody that don't need to get vaccinated is crackheads. Them the only somebody that survived the pandemic. I'm sorry, Dr. Billis. Dr. Billis, I'm so sorry. That slipped. Dr. Billis.
You know what?
I'm the expert on that.
Vaccinated, okay?
Right.
Everybody.
That's right. Yeah, but them crackheads got that same mask on their head since March. They wear it on top of their head. They survive. They asymptomatic. They got all kind of antibodies and Percocet mixed up. I'm sorry, Dr. Billis, I apologize for my behavior. Thank you. I know you'll never come on this show again. You don't
No, I have a lot of fun with you guys, and I appreciate your having me.
Yes, so ladies and gentlemen, y'all give it up for the one and only Dr. Tiffani Billingsly.